Hello and welcome to Health Professional Radio. Thank you for joining us today. Now, the liver is one of the most critical organs in the human body, yet many people tend to simply overlook it completely. Our guest is returning to talk with us, Dr. Gideon Hirschfeld, clinician and academic with a special interest in hepatology. And he's here today to talk with us about early detection of PBC and also to talk about some of the common misconceptions about liver and liver health, and to talk about some of the treatments that exist now that didn't exist 20 years ago. Welcome back to Health Professional Radio, Dr. Hirschfeld.
Oh, thank you for having me again. It's great to be here to talk about PBC.
Glad that you could return with us. Now, for those of us who may have missed other segments where we featured you before, give our listeners a little bit of information about PBC, some of the common symptoms, and is it something that's treatable?
Absolutely. So let me tell you, 1 in 1,000 women over the age of 40 live with PBC, which is an autoimmune disease of the liver where their bile ducts are attacked, and where, as that bile duct attack continues, they get cirrhosis and all the complications of cirrhosis. Alongside that, they may have a journey that has no symptoms, or they may develop very debilitating symptoms that can include itch, tiredness, dry eyes, dry mouth, and abdominal discomfort. However, once you've made a diagnosis of PBC, which you can do on simple serum liver tests and anti-mitochondrial antibody testing, you can offer your patients 2 licensed therapies now for PBC that are both shown to have an impact on the inflammation in the liver and which prevent the development of cirrhosis.
Now, you mentioned that there are 2 treatments currently available, among others. Are these 2 the most common, and are these 2 effective against all levels of PBC?
Well, we're still learning about the treatments for PBC because it's a rare disease. But for the last 20 years or so, we've had only one treatment, ursodeoxycholic acid, which is a bile acid that we all make. You take it in gram quantities, and when you take it, it seems to soothe the liver and seems to reduce inflammation and slow down the progression to develop cirrhosis. What we now have is a second treatment called obeticholic acid, or Ocaliva, which has only just been licensed at the end of 2016. And what this treatment is designed for is those patients who don't get the best response to ursodeoxycholic acid, or those patients who can't tolerate ursodeoxycholic acid. And what we've learned about this drug in clinical trials that have been conducted around the world is that when those patients added Ocaliva to their treatment, they saw an improvement in their serum liver tests. And we believe that improvement in the serum liver tests will translate over time to less fibrosis and less end-stage liver disease. So we're all really excited that we now have 2 licensed therapies for PBC, and that we know our patients can access those. They're both oral treatments. And really, the stepwise change can be just visioned by ursodeoxycholic acid given in gram quantities and obeticholic acid, which is a semi-synthetic bile acid given in milligram quantities. And so they're working in different ways. And in fact, we never really understood what ursodeoxycholic acid did or how it fully worked, whereas for obeticholic acid, we have a really good grasp of the science that has driven this new therapy and the way that this molecule tackles a very important pathway in the liver for healing inflammation, stopping fibrosis, and in fact, improving metabolic regulation as well.
Are these treatments a management tactic throughout the lifetime of the patient, or can these treatments be backed off a bit using simple anti-inflammatories be enough to continue managing the disease?
Well, that's a great question and another misconception about PBC. I'd love to be telling you today that we've got a cure for PBC, but we don't. So in essence, when we make a diagnosis and start treatment for our patients with PBC, we're talking about lifelong treatment because we know that lifelong suppression of the inflammation in the bile ducts caused by the immune system, by ursodeoxycholic acid and obeticholic acid, if you need to add that in, is seemingly very important. And if you stop the treatment, then the disease hasn't gone away and the patient will ultimately run into problems. So for the time being, the treatments that we have are lifelong and our patients are living with chronic disease. And that's something that we really need to work on to make sure we get that education point over to our patients and to all healthcare providers so they don't think that this is a quick fix. This is a lifelong partnership.
Aside from a routine blood test, testing liver function, what is the best test, in your opinion, for early detection of PBC?
Well, I think it's key that if you see somebody who's got what we call a cholestatic liver profile, so that's elevated alkaline phosphatase and gamma GT, then you want to do the anti-mitochondrial antibody, because in over 90 to 95% of our patients with PBC will be positive, and the combination of a positive anti-mitochondrial antibody with elevated markers of cholestasis, alkaline phosphatase and gamma GT, really secures the diagnosis of PBC. There's no need for a liver biopsy, and we can start treatment, we can monitor treatment, and we can tell our patients who needs more than just treatment with ursodeoxycholic acid, and in particular, which of our patients need second-line therapy with the newly licensed drug, obeticholic acid.
How much does diet play a role in the management of PBC once properly diagnosed, in addition to the therapies that are available now?
Well, diet's always important. So what we tell our patients is to be healthy, to have everything in moderation. But diet itself doesn't treat PBC. PBC needs to be treated with licensed medications. And
where can our listeners go and get more information online about PBC?
Well, there's lots of websites now for PBC, not just from the patient support groups, but from websites such as livingwithpbc.com and www.pbctogether.org.
Great. Well, I'm glad that you came back in and talked with us again, Dr. Hirschfeld. Always a pleasure.
My pleasure.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Gideon Hirschfeld, specialist in autoimmune liver disease, talking about early detection of PBC, some of the available therapies for PBC, and some of the common misconceptions surrounding PBC and liver health in general. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download as SoundCloud.